Okay, so today we are going to talk about health literacy. We're going to start off with what is health literacy and why is it important? Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and the services needed to make appropriate health decisions. Why is it important? It's because it affects people's ability to navigate the healthcare system, including locating providers and services and filling out forms. It affects the way they share personal and health information with providers. It also impacts how they engage in self-care and chronic disease management. It also plays a role in that whether or not a patient can adopt a health-promoting behavior such as exercise, healthy diets, and to stop smoking. Finally, the last thing is it helps people know how to react to health-related news and announcements. This was a big deal recently in the news with all the Ebola scare. A lot of patients were concerned that they had symptoms of Ebola. They wanted to be checked for Ebola. And their low health literacy contributed to their fears. They had no risk factors. They had minimal symptoms even, and they hadn't been exposed to Ebola, hadn't been diagnosed with Ebola. There was no concern medically, but because of their low health literacy, they were fearful that they may have contracted Ebola. Health literacy is dependent on several factors. One of them is communication skills of both the patient and the health professional. The health professional might be the nurse, it could be the physician, a pharmacist, it can be anybody that comes into contact. It may be one of the billing clerks or somebody from admitting. Even the CNAs have an impact on a patient's health literacy. Communication skills include reading, writing, and numbers, but also your oral communication, your bedside manner, comprehension, and they're context specific. You're going to talk a lot differently to a patient who's signing an informed consent for surgery versus a mother who's being discharged from her pediatrician's office. Their health literacy needs are much different. The patient going to surgery has to have a much different understanding of the paperwork that they're filling out than, say, a mother who's there for a well child exam whose child has no health issues at that time. It also depends on the patient's prior knowledge of various health topics. Limited or inaccurate knowledge can affect their ability to understand the relationship between their lifestyle choices and their health outcomes. They may not understand, a diabetic may not understand that eating a diet high in sugar is going to raise their blood sugar, or that they need to be sure to take their medicine with meal times. They think they just need to take it 3 times a day whenever. There's a lot of health literacy needs in patients with chronic diseases like diabetes. A patient who has had diabetes for years versus a newly diagnosed diabetic are going to get a lot different information. Their health literacy needs are much different. Perhaps the patient that's had diabetes for a long time has significant health literacy needs as well. Sometimes we label them as non-compliant, but we need to not use that. I've seen that throughout my studies at West Texas, that they say we need to not say non-compliant, and it's so true. It's not that they're non-compliant most of the time. It's that their health literacy is low, and they need educated. They need to have the tools they require to make the right decisions. Patients with little knowledge about health diseases can be overwhelmed when they're presented with information. So we need to break it down for them, simplify it as best we can to best suit their needs. The last thing that I'm going to talk about that affects their health literacy is culture. Culture affects how people communicate and how they understand health information. It affects how people think and feel about their health. Some cultures dictate when people can seek care and from whom they can seek care from. And it also affects how they respond to the recommendations for lifestyle changes and the treatments. So while their health literacy may be very high, their culture may prevent them from participating in some of the treatments that are recommended because their culture may prevent that, even though their health literacy may be very high. There's a few things health literacy is not, and I need to tell those to you too. Plain language. Health literacy is not plain language. It's not about it's not about having a good bedside manner or speaking slowly and listening to the patient. Those all need to be done, absolutely, without question. Those need to be part of your efforts toward improving their health literacy. But Plain language and health literacy are not the same. Health literacy also is not cultural competency. We just talked about that. Very important to include when you're talking to your patients about health literacy, but cultural competency and health literacy are not interchangeable. They are not one and the same. You need to remember to be culturally competent, but that is not the only thing that contributes to a patient's health literacy.